Hi guys, we are continuing with psychiatric section, schizo series of disorders, and this one is schizophreniform disorder, which is a short-term type of psychiatric illness with symptoms similar to those of schizophrenia. It's a very serious mental disorder that distorts the way a person thinks, acts, or expresses emotions, perceives reality, and relates to others. Similar should be present more than 1 month and less than 6 months. This one is corresponding to schizophreniform disorder. If symptoms are present more than 6 months, it is called schizophrenia. If less than 1 month, it is called brief psychotic disorder. And of course, usually if schizophreniform disorder is present in patients should return to their normal baseline level of functioning. Another important thing to know about treatment and baseline functioning, returning to the baseline functioning, as patients receiving some antipsychotic drugs, they can become depressed, and some suicide thoughts may coming in their thinking. What about risk factors? Young women represent a risk of factor. Environment, imbalance of neurotransmitters, especially serotonin and dopamine. Genetic and family history. If one of the parent is with psychotic symptoms. And symptoms by itself, which are very important, and symptoms of schizophreniform disorder are similar to those of schizophrenia and might include the following: hallucinations, delusions, disorganized speech, grossly disorganized or catatonic behavior, social and or occupational dysfunction, and negative symptoms. What represent hallucinations? Seeing, hearing, or feeling things that are not really there. And delusions. Hallucinations should be present and are represent most of the important symptoms in any of the psychosis. Delusions, false beliefs that are not based in reality and that the person refuses to give up even when presented with factual information. Disorganized speech, such as not making sense of not making sense or not using nonsense words, skipping from one topic to another too rapidly. Usually people when talking, they can change topics, but not suddenly and without any prediction. Odd or strange behavior, such as walking in circles, writing constantly, occupational dysfunction, and of course negative symptoms, which represent decreasing in activity which normally are present. So lack of energy, poor hygiene or grooming habits, loss of interest or pleasure in life, withdrawal from family, friends, and social activity. And final treatment: patients must assess whether the patient needs hospitalization or not to assure safety of patient and people around who interact with patient. Antipsychotic medication is indicated for 3 to 6 months course, and individual psychotherapy may be indicated to help. And of course, if some suicide thoughts are present, you should hospitalize urgently patient for stabilization. Antipsychotic medications like typical and atypical antipsychotics, aripiprazole or haloperidol if it is an acute phase, and clozapine for patients who are very resistant to treatment. And the question that everyone is interested: is there any way to prevent schizophreniform disorder? Not, but early diagnosis and treatment. are very important because they can help to limit damage to the person's life and other relationships. Of course, persons who are living in the vicinity. Have a good time and study hard.